So we're in the month of June, and 19th of June, the world will be celebrating sickle cell, those who've survived it, and even create more awareness. But even better, over here in Ghana, the Ghana Institute of Clinical Genetics tells us how far they have come in dealing with the issue of sickle cell and all you need to know about marking their 50 years of existence over here in this country. I bet you didn't know. Well, yeah. This morning, we're joined by Mrs. Josephine Otu, public health nurse, and as well, Dr. Alpha Chimisi, Otain hematologist. Just before we came on, I was just telling Dr. Alpha that he's the first person I'm hearing bears the name Alpha. And does he even often hear people call Alpha? But thank you for making time to join us today on the show.
Okay. Thank you for having us.
Every time we hear sickle cell, for me personally, I know that we've made some great strides in there, but it still sends shivers down my spine because it feels like it is almost a death sentence for somebody if they've been diagnosed of sickle cell. But today, let's get to learn a few things. Let's also get people to understand the genetics and all the factors that will contribute to it. I'll start with you, Dr. Josephine, or you'd prefer Dr. Otu? Dr. Otu, okay, all right, Doc. Let me come to you and find out first, really, what really is sickle cell?
Okay. All right. Thank you, first of all, for having us on the show. So sickle cell disease is a genetic disorder, meaning it is inherited. It's not like those that are acquired, like hypertension or diabetes. This one is inherited. And it's inherited in a pattern where you require both parents to either have the disease or be carriers of the disease. And then the affected individual, which is the child, tends to bear the disease itself. Basically, it affects a part of the blood known as hemoglobin. Hemoglobin is the essential part of blood that carries oxygen up and down. So when you have that being affected, then it leads to so many issues, complications for the patients. Primarily, what most of them tend to develop is pain, especially in the bones. And if it doesn't affect the bones, it also affects the other organs. So they tend to have complications that go on in the hundreds, possibly. So sickle cell primarily is a disease of the blood, affects the hemoglobin, and it is inherited. Okay.
At least now you have told us the cause, who can be diagnosed, and what the sickle cell for you as well. But let me go to you, who is a public health nurse. On the conversation of sickle cell, would you say that we've made some great or positive impact as a country?
Well, when you take when you take 100 newborn kids, every 2 kids or babies are diagnosed with sickle cell disease. And so with more advanced instruments, we are able to diagnose kids or newborns with sickle cell diseases.
Okay, I'll come back to Doug, and before we even continue with the public health sector side, so let's go into the causes more. You just said that it's in the blood. When I get curious, and I know you don't like us going to Google to go and be learning things, but when I get curious and I go into Google, I know that there's so many components in the blood and all of that. But genetically, it means that a person must be predisposed. Does that mean that?
Okay, not exactly predisposed
okay.
in the exact meaning of that word, but you need to have 2 adults who have the gene. So they either could be carriers of the disease, or they could have the disease itself.
Okay.
So speaking of that, there are 2 forms of the disease. There's a carrier state where you've inherited only 1 copy of the gene. And then there's the disease states where you have 2 copies. So, and the way the genetics works out is that if you have 2 people who are both carriers, they have a chance of passing on one of their defective genes to their offspring. So you can have an AS and another AS person, and they could pass on S, each of them could pass on the S to the child. So the child ends up being an SS child. If you have maybe an AS and then another SS, that other parent definitely has the disease, then you have a greater chance of even passing on 2 S's to the child for them to have the disease. So maybe I'll say predisposing factor would be having parents who either carry the gene or they have the full-blown disease.
Okay, you've gone into the conversation of genetics, where the alphabets start to play in. And so what are genetics and why is it important?
Okay, so genetics basically deals with the study of genes. genes are primarily what make us unique in our own being. So everyone inherits their genes from their parents. And the gene in question is what is causing the sickle cell. It's a mutated gene or dysfunctional or defective gene. And that is what is causing the sickle cell disease. The problem is big on this part of Africa because through evolution, a lot of people developed the AS genotype. And that was primarily a protective mechanism against malaria, because malaria is endemic in this part of the world. So a lot of people have AS here than other parts of the world. Then as you have AS pairing up, then you tend to have more SS in the system. Oh. There are other ones such as C. You may meet someone who has SC or AC, that's for the carrier state, or SC for the disease state. So they are also there as well. So you can have an AS, an AC, SS, SC, different combinations, depending on who your parents are, basically, and how you inherit. And the inheritance is totally random. So
I like how you're saying it with a smile, but I'm so afraid.
It's totally random.
It's random. So a parent can have like 10 children. Then out of that 10, what? Like one of them?
All of them could be SS, all of them could be AA, all of them could be AS. Once those two parents are either carriers or they have the disease. If they are AA, that means they are non-sickle cell, then the conversation is totally different. But once both parents either have the carrier state or the disease state, then there's a chance of having a sickle cell.
What's the percentage of the chance?
Okay. Yes.
Sorry?
That's if you have an AS mother and an AS father, then you have a 1 out of 4 chance of having an SS, and you have a 50% chance of having AS, and then a 1 out of 4 chance of having an AA.
Okay. Josephine, though, in the hospital, I mean, when people who have been diagnosed of sickle cell show up, what kind of symptoms do they show up with?
So most of them usually comes with body pains. And then there's something that we call acute chest syndrome. And so normally they come with chest pains, back pains, lower back pains, and then cough. We also have people coming with being anemic. And so thorough screenings are done for us to detect the level of their blood. And then if they need be for us to transfuse them, we do transfuse them. And then those that are to be managed on medications, we manage them. Apparently, we don't admit. We only detain them for some time. So let's say 4 or 5 hours. And then after they are okay, we discharge them. For those of them who are not able to recover, we normally transfer them to higher level for them to be seen. Okay.
I'm back in the consulting room, Doc. So by this time, they would have been diagnosed already, but I'm curious about the diagnosis, how you arrive at the diagnosis.
Okay. All right. That's important because most of us would be aware of something called the sickling test. It's widely done in secondary schools. That's a limited screening tool. The appropriate test to be done is called the HB electrophoresis. That's the test that ideally you should ask your doctor or walk into a hospital to get done. Because this test will determine what kind of genotype you have. If you have AS, if you have SS, SC, all the other types of hemoglobins. There are other abnormal ones. They are not in the large numbers like S and C. But once you do your HB electrophoresis, we'll be able to tell to a much greater detail what kind of hemoglobin you have, unlike the sickling test that a lot of people are used to. That could give you a false result.
Okay.
It's only picking up the S. So if you have AC, for example, you might be negative, and you think you're okay. You meet an AS lady, you fall in love and marry, and then you have an SC child, and that's the problem. So the test will be HB electrophoresis. HB electrophoresis.
Okay. Say that test again, because I'm certain you want to take your pen and paper and write it. So when you go to the hospital, you ask for that particular test. Say it again, though.
So HB,
Hemoglobin
electrophoresis.
And I'm kind of send it to me. I still can't keep it in my head. Okay, now let's even, knowing this, and of course we cannot learn all about sickle cell here on the show, and this is why you may encourage people to want to walk in to do a test and all of that, especially if you're planning on falling in love, or you're already in love, you're planning to make babies. But let's talk about the challenge as a country here. How well have we done in creating awareness or even the fight or trying to manage sickle cell as a health condition in Ghana, though?
Okay. How well we've done, not so well. The voices that have spoken for sickle cell are few. So you have people who are in a position to maybe do something about it, but they may either not know or have enough information. So we do need a lot of help in terms of advocacy. So in terms of education, trying to prevent the disease itself, not so well. So that's one of the reasons why we are coming out this year. Let's come and celebrate 50 years out with everybody so that we can all know that sickle cell is real. It's affecting a lot of people. As Josephine said, 2 out of every 100 births, 2 children have the disease, and it's a big problem.
That's a big problem. Josephine, in your clinic particularly, what differently are you doing in terms of holistic approach? In your clinic, what are you doing?
So in the clinic, we normally do counseling and education a lot. So we educate all patients and caregivers that visit the clinic. We talk about sickle cell, the signs and symptoms of sickle cell disease, and how to manage or prevent the occurrences of the crisis. And then we also do genetic counseling for people that are interested in getting married. We counsel them on the genotypes, and then for them to consider it very well and then take decisions before getting married.
Okay. What about those who have already been diagnosed? At your clinic, do you do anything special as well for them?
Yes. So as she said, the education, counseling is very much at the forefront of the care. For those who have already been diagnosed, so what we do is we teach them how they can prevent the crisis that usually comes with sickle cell disease. You can have sickle cell disease and to a very large extent live quite a healthy, normal life. I mean, previously, sickle cell was a death sentence, as you said in your intro. But we do have patients in our clinic in their 6th decade, 7th decade, 8th decade, coming for reviews. And over time, through research, we found ways and means of staying healthy as a sickle cell disease patient. So we go very much in that direction, preventing the crisis first of all, so that you don't have to be rushed in every now and then with pain, or even develop the complications that we're worried about.
So should I believe the theories that I've been reading about in the news? Is there hope? Can we now cure sickle cell? I like the smell. I like the smile on both of your faces.
Well, this smile is not a smile of disbelief, it's a smile of hope.
Okay.
So yes, there is technically a cure for sickle cell disease, and that would be to have stem cell treatment. That is, however, not available in the country. It's available outside, but quite expensive. What we have in there is rather we have newer medications. Some of them are still in the stage of research. Some of them are already out. A drug like hydroxyurea, which helps to minimize the crisis for a lot of people, and then manage the anemia that Josephine also spoke of, like in terms of how often your blood drops for which you need blood and all that. Beyond that, we also encourage them to be on their routine medications, folic acid, multivitamin, adequate hydration, and then our main gun in this is the education.
Okay.
Eat well, rest well, drink enough. We show you what to avoid.
Okay, Josephine, so this year, the theme at the hospital, tell me about it. How are you celebrating 50 years? I can't believe that you've been doing this way years before I was born. Congratulations, really.
Thank you very much. So this year, we are 50 years old, and then the theme for our celebration is shining light on sickle cell, creating awareness and advocacy. And so we are admonishing that individuals and then stakeholders, government and NGOs who come to our aid, because 50 years of we being in existence is a lot, but we need more help. We need more infrastructures so that it will enhance our care that we give. Apparently, we don't admit our patients, and so whenever it happens like that, they have to either go home and then come back again, or we refer them to.
In fact, a minute on that. This non-admission of patients, is it a clinic directive, or it is what the illness requires, or it depends, it's a case-by-case matter?
It's the way the clinic is set up.
Okay.
So as she said, we need the infrastructure and the support.
Oh, so if you had the chance, you'd admit?
Yes.
If you had the infrastructure, you would.
So it's basically a day clinic where we manage the emergencies. About 90% of them will do well within the period they are with us. Thankfully, we have very dedicated doctors and nurses at the clinic. Sometimes some of them stay for hours just with one patient to make sure they are fine before they are discharged. But for the few cases, like she mentioned one complication earlier, acute chest syndrome, which is like a very severe form of pneumonia, you may need admission for that. So for something like that, no matter how long we stay with you, we'll still have to admit you to the main emergency at Kolebu Teaching Hospital.
Okay, okay. Please proceed.
Okay, so, and then also we have patients coming in with, we have patients coming in with low socioeconomic status. And for such patients, we have to be running their hospital bills and all that for them. And so we are calling on all stakeholders to come in. Though they, normally there are fewer people or individuals that donate some form of cash for us to manage. But of course, we cannot depend on those monies alone. For us at our Ghana Institute of Clinical Genetics, we depend on our NHIS.
Okay.
So that one alone too is not sustainable. For how long are we going to be on NHIS to cater for our patients? And so we advise that individuals out there, we advise that government and non-governmental agencies... Just
when you like yourself on the screen, huh?
Come to our aid to support the clinic and then get the necessary things for us.
That you would need at the
yes,
clinic.
Exactly.
Okay. But Doc, so this the celebration, are there any activities planned, if you can run me through quickly?
Yes, we do have. So on 14th of June, before the World Sickle Cell Day, we have a float. We'll go out through the communities, through the principal streets of Accra, just to make some more noise about our birthday, and then also educate people one-on-one. We'll share tracts and the rest. 19th of June on our premises, we'll celebrate World Sickle Cell Day and also launch our 50th anniversary. Then in the month of July and August, we have a lot of outreaches. Some of them are school-based, some of them are community-based as well. And then finally,
health screening.
We have health screening as well.
On the 14th or on the 19th?
No, beyond the 14th.
Beyond the 14th.
Okay.
That would be in August.
Very importantly, I have to mention on the 14th as well, we're partnering with the National Blood Service Ghana to organize a blood donation exercise, because sickle cell patients tend to require blood quite often, and we would want to do our bit in ensuring that there's enough blood. So there is a blood donation exercise alongside the launch and celebration of World Sickle Cell Day at the premises of the clinic.
Okay, I'm certain we can have this conversation on and on and on, but I'm certain would either be there 14th or 19th to be able to throw more light on the activities that you're doing at the clinic. But thank you, Doctor.
And then also in October, there is fundraising and dinner.
Can you say I don't forget to? When you say it's now, what would you do? Okay, but thank you. October what?
October, the date is not yet fixed.
Okay, all right. We'll put that in our diaries. Thank you so much for joining us today. Wish you all the best on the 14th, the 19th. You have another thing to say?
Yeah. So for those of us that want to sponsor our celebration or help in one way or the other, can we put our numbers there? Yeah. So 05543 11450, 05543 11540, and then we also have 02096268867. All sponsors are welcome.
Of course, please, Josephine really needs the sponsorship. Thank you so much, Doctor. Thank you so much, Josephine, as well. I'll not forget your name. Dr. Alpha Chumisi Oteng is a hematologist. Thank you so much for joining us today. You're still watching the AM show. We're nearly wrapping, but I want to say happy birthday to Mr. William Danso of Send Ghana. God bless you so much. And this is coming from our producer here, Mr. Otu, Kingsley Otu. And as well, a happy birthday to you, Pastor Mauli. Pastor Mauli. Oh, no. So happy birthday from Pastor Mauli at MGL to Reverend Francis Kwamezo. Reverend Francis Kwamezo, the esteemed lead pastor of New Life Assemblies of God. It's your birthday, happy birthday, and this one is from Pastor Mauli here at MGL. As well, get ready for the 7th Ghana Football Awards. Join us on the June 14th at the Palms Convention Center for a night of excitement, glamour, and celebration of Ghana's finest football stars. Let's unite the nation once again through football. Ghana Football Awards is a Football Impact Africa initiative powered by Activate 360 and proudly supported by the Multimedia Group and AE Mediacom. Ghana Football Awards, celebrating the stars of our passion. Please stay with us. Well, before I go, conference, the Chartered Institute of Human Resource Management, Ghana, present the CIHRM 2025 conference on June 18th to 19th, 2025 at the Alisa Hotel. And the theme is Regulating HRM in Ghana, Standards, Ethics and Sustainability. Conference rate as well, members will be 3,200 Ghana cedis. 3,200 Ghana cedis, and non-members will be 4,000 Ghana cedis. And then for students, you have a discount, it's 2,000 Ghana cedis. You want to register now via the CIHRM website or at CIHRM Ghana on Facebook, LinkedIn, and X as well. You can contact them on 0243 78690 or 020-811-2 for group registration and discounts. Now, CIHRM, transforming work and workplaces. You want to stay with us? We'll be back shortly.